There's a new family planning method called Standard Days Method. It is a natural method and has no side effects. It is used with a visual tool called CycleBeads and is based on the fact that there are certain days in a woman's menstrual cycle when she can get pregnant. With this method, CycleBeads are used to identify when a woman can get pregnant. During this time, a couple uses a barrier method like condoms, or they do not have sex to avoid pregnancy. We participated in a research project to better understand the effect of adding CycleBeads into family planning services. Based on this experience, we will hear what clinic staff, clients, and program administrators are saying about CycleBeads.
I had gone to Planned Parenthood and asked them about different types of birth control methods, and after an extensive conversation with multiple nurses and doctors, I finally found out about CycleBeads because I just didn't do well on the hormones.
It's very easy for me. It's more easy. Just move the ring and see the calendar than taking pills or something. I like it more, CycleBeads.
It's very, very simple, and then I can help my wife. So
it's just a really natural, safe, effective way to prevent or plan, parenting or pregnancies.
This thing can help you and your husband to have a better relationship, because you have a better communication, because both are looking at the calendar and checking the dates and when you can stay having sexual relations and when not. So it's very easy.
I just mark my calendar, and then I go back and what day was it? Okay, and I'll count along. Because the thing is, he asks me. He's like, are we on the colored days yet? He's always like, what day are we on? And it's great because it's not something that, not a method where I've ever had someone so encouraged to or motivated to ask me what's going on with my menstrual cycle.
If it was on one of the white beads, I'd just be aware that those were the times that I can get pregnant, so I'd kind of be a little, safer about my sex. However I had sex, I'd probably use a condom or wouldn't have sex for that time.
There's other intimate ways to share your love other than having sex.
Now CycleBeads is part of all of the methods that we offer in our clinic, and it just gives us the opportunity to provide a wider spectrum of birth control options with women who come in.
The first time I heard about CycleBeads, I was really happy to hear this, tool actually exists to helping my patient who like to use natural family planning.
It's been very useful to teach young women about their cycle. A lot of people have misconceptions on when they actually can get pregnant or how many days a woman can get pregnant, and many of the teens that I spoke to thought it was only maybe 2 to 3 days, and when I used this tool and I showed them actually how many days a woman can get pregnant, they were pretty surprised.
It's easy to use, it's effective, it doesn't have side effects, it's natural, and it's inexpensive. It doesn't protect from sexual transmitted infections. You need to be screened in order to know if you are a good candidate for CycleBeads. You need to have regular periods. So, you need to have a menstrual cycle. It needs to be between 26 and 32 days. So I think that those are the disadvantages of CycleBeads.
There are clients who don't want to use any kind of hormones or anything with side effects, and so they gravitate towards the Standard Days method with the CycleBeads because there's nothing to take, nothing inserted or implanted, and it's within their own control. What's great about CycleBeads is that the men can actually be more involved in preventing pregnancy because they can see on the CycleBeads when the fertile days are and when they might need to use a condom or abstain from sexual intercourse. And nobody needs to tell them this, they can see for themselves.
I think this is one of the great things about CycleBeads as a method is it's this very tangible thing that a woman can use on a day-to-day basis to know when she's fertile, but at the same time it sparks conversation about the subject. I think one of the biggest concerns was, as with any clinic or any practice like ours, is how much time would be taken aside from just regular, the regular daily duties to implement this. And as far as specifically about the CycleBeads, I think most of the people on the team had a similar attitude that I did in that, it looked like it could be something that would really be useful to the populations we serve.
Now that the project is over, we still offer CycleBeads as a method. It's just one of our other birth control methods that we talk about. People still come in and are interested in a birth control that doesn't cause any side effects. And like I mentioned before, as long as you have like a wide option of birth control options, then it's helpful for women to decide on what they feel is best for them.
I think what's really important is for staff to keep an open mind when they first see CycleBeads, whether they're pro-natural family planning or haven't had great experiences with it, to remember that clients are the ones who need to like or not like the method and to choose the method or decide not to use it. And CycleBeads is yet another option for women to prevent pregnancy.